Welcome to this year's Get to Know the Candidates session with the National Environmental Health Association. This year we have two candidates for the second vice president position. Those candidates are Dr. Sean Beeman and Kim Carlton, and each of them will have an opportunity to introduce themselves here in just a minute. I wanted to remind everyone that this election will run from March 2nd through March 31st. And the folks eligible to vote in this election are life and professional members of NEHA. The second vice president position is a 5-year term position. It's serial succession through the second vice president, first vice president, president-elect, president, and past president positions, and is a member and a leader on the 14-member board of directors for the National Environmental Health Association. With that, I think I will throw it to Kim to introduce yourself, and then next we'll go to Sean to introduce himself.
Thank you, Tom. Hi, everyone. I'm Kim Carlton, and over the past 25 years, I've worked my way up from intern to city health inspector to statewide leadership roles. Today, I serve as the Retail Food Program Manager of the Minnesota Department of Agriculture, where I oversee a program that serves more than 7,500 businesses. I manage a multi-million-dollar budget, and I lead a team focused on inspections, compliance, and quality management systems based on the FDA standards. Before that, I supervised workforce development at the Minnesota Department of Health, helping to strengthen our local program oversight, coordinating outbreak response, and securing federal funding to expand our training capacity. I've been a NEHA member since 2007, and I've served as a regional vice president, representing 6 Midwestern states and bringing their voices directly into our board conversations. Throughout my leadership and national service roles, I've gained a clear understanding of the role that NEHA plays in connecting and strengthening our workforce. I'm super excited to be here today, and I appreciate the opportunity to share more with you about what I have to say about NEHA. Thanks.
Thank you, Kim. Go ahead, John.
Good afternoon for everyone's good morning from me. See a little bit about myself. I'm married. I've been married to my wife for 34 years. I'm the father of 2 wonderful young men that both live back in Texas. I have served in the military for 34 years now. The first 14 years of that, I was a search and rescue swimmer in the Navy. And then completed my undergraduate degree in biology and decided that I wanted to pursue a career in public health. Switched over to the Army at that point, and I've spent the past 20 years as an environmental science officer working in a variety of positions around the world. Started off as a project officer and program manager for what was then the Center for Health Promotion and Preventive Medicine in Europe, working projects all across the European region and into CENTCOM as well. Following that, I was a lab director for the First Area Medical Laboratory, and then went to a position as a health promotion and health protection officer for Region South in Afghanistan, and from there to the director of EH for the U.S. Army in Colorado and Utah. That was when I was stationed in Fort Carson. After that, they sent me off to get a PhD and then brought me over to Uniformed Services University, where I served as an assistant professor and the division director for environmental sciences. From there, I was lucky enough to get this position here in Hawaii, where I serve as the deputy director for public health for all U.S. Army installations in Hawaii. I'm also the Force Health Protection Officer for 18th MedCom, which makes me responsible for the Indo-Pacific region. As such, I oversee health protection efforts for over 500,000 people here, executing a multi-million-dollar budget, Keeps me significantly busy, but fortunately, I'm looking at potentially retiring here in the next year. I've done my 20 and I've had a wonderful time with it. And I'm looking for a new challenge now. I've been a NEHA
Thanks, Sean.
member for several years, and I've got my earned my REHS from them, and then after a period of time, went on to get my diplomate status from the Sanitarians.
Great, thanks. I should have introduced myself as well. I'm Tom Butts. I'm past president of NEHA. I was on the board for 5 years, starting in 2020 in the COVID year. So the organization has certainly gone through many, many challenges and continues to face challenges of one sort or another. So as each of you, the two candidates today, think about, where we've been, where we're going, and some of the challenges that we can expect and some of those that we can't expect, but that will know likely arise. So I've got probably 8 or so, 9 questions we'll walk through. If those participating have a specific question they would like to raise, you can drop that into the Q&A, and if we get a chance, we'll get to those. Can't guarantee we'll do that, but we'll try. So I will start with this question, and Kim, if you want to take the shot at it first. How do you encourage innovation and creativity in a team? Really, the NEHA board is all like a team. And the NEHA organization is, I think, a very team-oriented organization. So,
Yeah, so for me, innovation starts with psychological safety, creating an environment where people feel safe to experiment and take risks and even fail without fear of judgment. And at the organizational level, we need to be willing to honestly evaluate programs and adjust when something is no longer serving us. So in the past, I've encouraged my teams to step back and focus on the core of what we're trying to accomplish, and then explore different ways to get there. I make it clear that trying new approaches, even ones that might not succeed at first, is part of the process, and that pivoting can be expected and even supported. So my role is to reinforce that safety, helping my team understand why the work matters, giving them the confidence to try new ideas, and reassuring them that learning along the way is part of the process. When people feel safe to experiment, creativity naturally emerges, and we can keep improving the ways that we do our work.
Sean, same question, and let me know if you need me to repeat that.
So, much along the same line, for me, innovation starts with giving people permission to question the way we've always been doing things. I like to start with what problem are we actually trying to solve here, and then explore how we can go about improving this, looking at how tools like geospatial analysis, modeling, or AI might actually help us solve these problems faster or better. I like to also bring in different disciplines and different partners to work together, because frequently we get wonderful new ideas from these collaborations. And I would like to see NEHA be the place where members can share these innovative approaches, test them, and then potentially scale what works.
Thank you. Sean, I'll give you the first shot at this one. What methods do you use to motivate and inspire your team?
So for motivating and inspire my team, I like to begin with a purpose. Environmental health professionals, we safeguard communities in ways that frequently go unseen, but are incredibly important. When people understand the impact of their work, motivation follows naturally. I like to remind my teams that every inspection, every single sample we take, every analysis is designed to protect the families that we're responsible for. I like to focus on giving people chances to grow, lead, and develop new skills. Make a point of celebrating both individual and team successes. Within NEHA, I'd like to foster that same culture, where members know their expertise is valued and that they're responsible for shaping the direction of their association.
Thank you. Kim?
Yeah, very similarly, my approach is grounded in clarity and trust. I've led some large change efforts over my career, and what has worked best is being transparent about the challenges, putting the real issues on the table, asking what problem are we trying to solve, and inviting feedback early. Because when people understand the why behind a project or something that we're trying to accomplish, and they feel heard and they see that their expertise is not only valued but needed, they are much more likely to engage. So, my role has been to create structure and remove barriers and keep the work aligned with our larger purpose. Environmental health work protects communities in ways that most people are never going to see. So, I try to make sure that our teams connect back to seeing that impact because that's where the real motivation comes from. So I've been super fortunate to work with incredibly capable professionals, and my job is to create the conditions to let them do their best work and then get out of the way. And that's how I would approach leadership at NEHA too, with clarity of purpose, transparency about challenges, and then trust in the expertise of the people doing the work.
Thank you. Speaking of the people that do the work, NEHA's membership is about well over 7,000 now. It's really grown over the last few years, which is tremendously exciting for those in the organization. How can we best care for those NEHA members who are customers? And Kim, or Sean, I think, or no, Kim, it's your turn to go first. Sorry.
Okay. So our members don't need flashy slogans and platitudes right now. They need useful resources and clarity and respect. They are working in complex, challenging environments, and one of the best ways that NEHA can care for them is by remaining a steady and practical and responsive resource. So we need to make sure that what we offer is truly relevant to their day-to-day realities. With limited resources, we have to be disciplined about focusing on the programs and services that provide the greatest value, whether that's training or advocacy or credentialing support or opportunities for connection. I think it's healthy to periodically ask if we are investing in the products that members rely on the most, and if we're being clear about what NEHA uniquely provides. Caring for our members ultimately looks like listening carefully and using our data thoughtfully and aligning our efforts with where the profession needs us so that when members pay their renewal dues, they feel confident that they're getting tangible value from us.
Thank you, Kim. Sean?
So I see our NEHA members not just as customers, but actually as partners and on the front line of protecting community health. Taking care of them means that we need to offer high quality, accessible training, strong credentialing opportunities and career pathways, and advocacy that reflects what they're actually facing in the field, regardless of whether it's a foodborne outbreak, wildfire event, drinking water issues. It also means building real networks of mentorship and support across various sectors so that members feel connected and backed up through their careers. When members feel supported and heard, NEHA's doing its job.
Thank you. And Sean, this next question will go to you first. What are some of the ways that NEHA can grow and adapt to changing circumstances to remain relevant? And I think, given the recent announcement about federal funding from CDC, which does potentially impact NEHA, think about that as the frame for answering that question.
Well, for NEHA to remain relevant, it really needs to be the home for environmental health professionals. Needs to be where they can go to find the latest knowledge, a strong supportive community, and a voice that acts on their behalf. This means keeping our education offerings modern, integrate tools like AI, geospatial analysis, predictive modeling into our trainings, staying ahead of emerging threats. We have climate-driven hazards. We've got new vector-borne diseases that are popping up all the time. Also means that we need to listen carefully to our members that are in the field and make sure that we're aligning our policies and programs so that these needs are that we address. The work that we're doing here at NEHA is practical and impactful. Based on the current geopolitical issues that we're running into. This is going to really require NEHA to kind of step up even more to provide that focus and that leadership for our field, given the impacts that certain decisions have been made at the federal level have had on our field.
Thanks. Kim?
Yeah, this is a great question. So I see growth and adaptation kind of similar to tending a garden, right? Sometimes you need to do some pruning for your plants to flourish so they can focus the energy on where they need to grow. So NEHA, we do this by strengthening by our foundations, right? So we can remain steady and relevant and reliable and responsive to our members. So, focusing on keeping our programs and our guidance and our advocacy closely aligned with the real world challenges that environmental health practitioners are facing. Workforce pressures aren't theoretical. They are showing up in very real funding cuts and staffing shortages and expanding responsibilities in the face of increasing public expectations and decreasing public trust. So for us, I think adaptation looks like providing practical, high quality resources, timely training, technical support, peer connections, policy guidance without adding to the noise. If our mission is to build and sustain and empower the environmental health workforce, we have to stay closely connected to what our practitioners actually need and have the discipline to focus our energy so we can continue to grow.
Thank you. Yeah, some challenging times and unprecedented, unpredictable waters that we're in. And Kim, I'll give you the first shot at this question. Can you talk about NEHA's mission, vision, strategic direction, and how that aligns with your goals as a potential second vice presidential candidate?
Yeah, so what stands out to me about NEHA's values is the commitment to advancing environmental health and supporting the professionals who are doing this work every day. My vision is that every environmental health professional, whether they work in a small rural county or a tribal nation or a state agency or a federal agency or in the industry, wherever they work, you name it, they can look at NEHA and say, this organization understands my work and strengthens my ability to do it. So, if you look at NEHA's current offerings from student scholarships and internships to the Leadership Academy, credentialing, the journal, government affairs insights, the online community, these all help build a workforce that is capable and credible and connected. And those themes align with my leadership goals, which is supporting the people, strengthening our profession's credibility, and ensuring that NEHA can consistently deliver what environmental health professionals need to protect public health.
Thank you, Kim. Sean, did you need me to repeat that question?
My apologies. I had to stick my head out real quick. Repeat that one more
The
time.
real world does not stop while we're on this session today. So can you talk about how NEHA's values, mission, vision, strategic direction align with your goals as a potential second vice president?
So, okay. NEHA's mission is to build, sustain, and empower an effective environmental health workforce. Its priorities focus specifically on constituent insight, thought leadership, operational excellence, and these resonate with me, and my goals as the second vice president align with that. I want to develop and maintain strong affiliate relationships, grow and support the workforce through increased training, mentorship opportunities, credentialing opportunities, in particular for rural, tribal, and underserved communities, and then provide sorry, having a hard time putting words together, data-driven decision-making and strategic execution that's rooted in transparency. This, in my opinion, ties in very, very nicely with NEHA's core values and my particular goals as the second vice president.
Thank you. This next question will go to you first, Sean. What challenges have you faced as a leader, and how did you go about addressing those challenges?
So one recurring challenge I've encountered throughout my career has been leading through change with competing priorities and limited resources, something that we're all definitely dealing with right now. The way I approach this is to listen first and then use data to clarify what matters the most, and bring people together from across discipline, from a variety of agencies to solve these problems as a team. It's the mindset that I would like to bring to the NEHA board, using open communication, evidence-based decisions, and then shared responsibility for results.
Thank you. Kim?
So I think the most challenging times I've faced as a leader have been when there's no clear playbook for what to do, right? So recent example, among the backdrop of my normal work and our regularly scheduled disruptions, last month my team was doing recall effectiveness checks in grocery stores that had received grossly contaminated product from a local warehouse. And so we were doing those checks, and that coincided perfectly with the influx of federal immigration enforcement to Minnesota. And many of the grocery stores that we were in the most heavily impacted communities. So we had to decide how we were going to get the information that we needed and pull contaminated product from the shelves while keeping my staff safe and not putting undue stress onto the business owners in these neighborhoods. So to get through this, as I get through most challenging situations, I focused on the purpose of why we were doing these checks in the first place, identifying what we were able to do with the resources that we had, and supporting my people who had to do the work. NEHA is facing some uncertainties right now. We have our funding shifts, our workforce strain, and my experience of leading through disruption without panicking is what I would bring to the board in these situations.
Thank you. Let's see, Kim, would you share what you think are some of the most important lessons you've learned about leadership and how you might apply those to the second vice president role?
Yeah. So, one of the most important lessons I've learned is that scarcity is real, but panic isn't helpful, as I just shared. When resources are tight and expectations keep growing, the instinct can be to focus on everything that you don't have, right? I don't have time, I don't have people, I don't have money. Sounds familiar to many of us, right? And I've learned to pause and shift that question around. So instead of asking, how am I going to get all this done with what I don't have? I ask, okay, so what do we have? And what actually matters most in our work right now? And what can we do that will move us closer to fulfilling our mission? So in my current role, I'm constantly managing staffing deficits while responding to emerging priorities. And it would be easy to just react and, kind of just give up. And honestly, some days I kind of have a minute where I need to breathe. But leadership requires deliberately choosing what you can and cannot do with the resources that you have and with what is in your control. And as leaders, the hardest thing we have to do is entertaining the idea of letting go of how we've always done things, because responsible leadership requires thinking about creative solutions and being willing to work differently if needed.
Thank you. Sean, your take on that question?
So I've had several lessons that I've learned over the years that have really stuck with me. First of all, listen before you decide. Leaders who listen well make far better decisions, and the frontline professionals, usually understand the problem significantly better than the leadership does. So make a point of spending the time to talk with them and listen to what they're bringing to the table. Second of all, be transparent. In particular, in times when you have limited resources and you're dealing with these competing priorities. Credibility is built through consistency and transparency. Third, and probably most important in my opinion, invest in your people. The best leaders understand that people are an organization's greatest asset. The organizations that fail are the ones that put people second. So we need to focus on people and make sure that they understand that they're appreciated and that we're investing in them. These lessons have proven true for me, in deployed settings, here when I'm managing large scale environmental health programs, and I would continue to follow them as a NEHA board member.
Thank you. I think we've got time for one or two more questions here, so I will jump into one more. And Sean, we'll start with you. What is your top priority right now, and how does that mesh with what you think NEHA's top priority ought to be moving forward?
So right now, I'd say my priority is strengthening and modernizing the environmental health workforce so that we're ready for the challenges that we're not only facing now, but the ones that are coming next. This means broadening access to high quality training, building strong mentorship and leadership pipelines, and bringing new tools like data analytics, geospatial intelligence, and AI into everyday practice. Ensuring that people across our organization, rural, urban, tribal, underserved settings all have access. If elected, I want every member to be able to say that because of NEHA, I'm better equipped to protect my community.
Thank you. Kim?
Right now, my top priority is the people and supporting the environmental health workforce through these periods of uncertainty. Our workforce faces unprecedented challenges every day, and I'm honestly looking forward to a day when we have precedented challenges back. But NEHA has to remain a steady, credible source of guidance and support. We need to listen closely. We need to provide practical resources and make sure that members feel like we truly have their backs. At the same time, NEHA needs to evaluate and strengthen its core functions and focus on what can be done with the resources that we have, and explore ways to expand our revenue stream so we can continue providing top-notch leadership for the profession. If we take care of the workforce and help them navigate change, feel supported, and access the tools that they need, we've succeeded in our mission. So my goal is to ensure that NEHA continues to be that stable and trusted partner so that our members can focus on what matters most, protecting public health.
Thank you. I think that's probably about as many questions as we have time for. So I want to thank both of you for your thoughtful responses to the questions we were able to pose today. As the organization moves forward with the funding challenges, the board and the executive leadership certainly have interesting times ahead to work on addressing finances, administration, support for folks in the field at every level, really. So I thank you for your thoughtful contributions there. I'll remind everyone that the ballots will be in your email on March 2nd. And those, again, for folks in the professional and life membership categories. So when you get that, be sure to thoughtfully respond. And with that, I wanted to thank both Sean Beeman and Kim Carlton, two highly qualified folks that we were happy to have as candidates for our second vice president for the National Environmental Health Association Board.
Thanks for having us.
Thank you so much.
Thanks very much.